I don't think it's too much to ask if you're going into a clinical setting that you have maximum protection.
In 2023, we recorded a senior Labour politician speaking honestly about COVID. His name is Andrew Gwynne, and he's now in charge of public health and prevention. His job is to protect us from COVID. So why isn't he? Before he came into power, he believed in protection.
I'm very much of the view that in healthcare settings, people should be using masks.
He knows COVID spreads through the air we breathe.
It's good practice anyway now in medical settings that staff and patients and visitors really should mask up, because you are talking about people who are incredibly sick and ill. You're not just putting them at risk, you're potentially bringing all kinds of nasty stuff into what should be a relatively sterile environment. It's just good public health advice anyway.
He heard the experts at the COVID inquiry. He knows surgical masks are not designed for airborne viruses.
Surgical masks are not protective against airborne infections.
Indeed, fluid-resistant surgical masks are not even classified as PPE.
Surgical masks don't protect against aerosols, do they?
No.
He knows how to get excellent protection.
The appropriate kit to guard against airborne transmission is respiratory protective equipment such as powered respirators and FFP3 respirators.
He knows why we should be protected.
Even with a sniffle and a sore throat, you can get debilitating long COVID symptoms forevermore.
So, he knows COVID spreads in the air like smoke. He knows it's still infecting, disabling and killing us. And he knows we can easily prevent it. So why isn't he educating the public and healthcare workers? Why isn't he preventing infections in hospitals and schools? Andrew Gwynne has the power and responsibility to protect us from COVID. So what's stopping him?